That's why it's blown up.
No,
can you imagine if it was related to
you are not also understanding.
If you have that mindset.
A few moments later.
I am prepared for us to come around the table and discuss whatever we need to discuss. And so my humble appeal to my wonderful medical doctors and health professionals at Tamale Teaching Hospital is that I am the first person to take care of your interest. Therefore, let's call off the strike and let's all regroup.
So welcome back, guys. I told you today I'm going to bring the stories to you back to back. So welcome to the second episode of NG Update. So this is an update on the story I just did, Tamale Teaching Hospital. So that is the update that is coming right now. Right now, you see the doctors of the Tamale Teaching Hospital released a statement. According to them, if the minister amber out to apologize to them, they are going to put down their tools, they are going on strike. So like joke, they went on strike. That is the statement. They went on strike yesterday, and some scenes from the hospital yesterday clearly tells that patients are there, no doctors to take care of them. No doctors were there to attend to the patients. So the patients were stranded. The video was circulating. Joy News posted that video. So the health minister sat down and realized, said, no, what is happening right now? The doctors are requesting for an apology from the health minister. And another statement that they released is that even before they will come back to office, they listed some things. They listed some things that they need before they can start working at the hospital. That is the things they listed. It's not really clear, I can't read it, but they listed about 7 to 8 things that, according to the doctors in the hospital, needed that items before they can start working. So what happened is that the Minister for Health called for a press conference, and according to him, first of all, he apologized to the doctors and told them that they should hold on the strike, they should come together, meet, solve their differences so that they can work so that peace will reign. Listen to the minister.
For the past 2-3 days, I have been speaking to stakeholders in this sector. And please, it isn't everything we can put out there as leaders. I am prepared for us to come around the table and discuss whatever we need to discuss. And so my humble appeal to my wonderful medical doctors and health professionals at Tamale Teaching Hospital is that I am the first person to take care of your interest. Therefore, let's call off the strike and let's all regroup.
So after this, we also saw some items that were packaged to be delivered to the hospital.
We are all into this together, and I believe everybody wishes well for the sector. Arguably, I know this sector is one of the most important and critical sector we all need to pay a particular attention to. This morning, as has already been indicated, I have some equipment, some consumables, and some medicines to be donated to Tamale Teaching Hospital. I have with me some members of the management of Tamale Teaching Hospital. And as you can see, we have the EEG as part of the donation, nebulizer set, we have the fetal heart detector, we have the ECG machine, we have the ICU ventilator, we have the ICU, that's a Draga ventilator, we have the Draga ICU cardiac monitors, we have the anesthesia machines, and we have infant incubators. There are about 35 items that we are going to donate today. But ladies and gentlemen, the health sector of this country has experienced decline for the past 8 years. And for that matter, I acknowledge that the health professionals have worked under challenging circumstances. I'm the first person to appreciate that. And we are committed as part of the reset agenda in righting the wrongs. But I know that it will not be easy. I need the cooperation of everybody, especially the health professionals. I cannot do all this alone. Without the cooperation of the medical doctors, the nurses, the pharmacists, much cannot be achieved. Irrespective of the challenges, what I want to appeal to all the facilities in this country, that let us ensure the optimum utilization of the limited resources available. This is one of the ICU ventilators, and I'm told that even when the lights are out, they still have some batteries to sustain it for some time. And so I wish and pray that the facility will take good use and good care of the machines so that it benefits the people in the catchment area. I thank you.
Thank you very much.
Travel to the minister. But I was asking myself, so if the doctors didn't, something like that didn't happen at the hospital, let's say a patient, we didn't say the patient that died, was good or something. But let's assume say that patient didn't die and the news didn't come out, people, didn't start dragging the hospital, the health minister didn't visit the hospital and car. They wouldn't have donated those items to the hospital or what? So we had those items there. So what prevented them to go and present that item to the hospital? So you see, it's not like Ghana, we don't have the facilities or we don't have the resources or something. The thing is there, but they don't want to give it out. Sometimes I don't understand.
It's just crazy.
What is wrong with them? So we have the items there. And I'm sure that is not the only hospital that is facing challenges like this. We have government hospitals. And Tamale it's a teaching hospital. So what are they teaching the students? What are they using to teach them? Because even water cry is not flowing. Water. And according to the release that the Tamale Teaching Hospital doctors released, it's not like they are not doing their best. It's not like they are not working. They are working. I have been to a hospital where there is no bed. The doctor took me to his office because there is no. So we have doctors that are working, willingly working. They are working. So the minister going there to interrogate, even that one is an unethical. I know I am not a PRO professional, but I know what is ethical and unethical when it comes to PRO work. There are some information that you don't need to disclose them to the public. What the minister did, I am thinking that the minister could have called the doctor to his office and had that interrogation. Having that interrogation openly, if you realize when the doctor was talking, he was a bit shaky. He was not comfortable. So, in one way or the other, what the minister did was not. It wasn't something that Mecca said he did well at that. He didn't do well. So let me know in the comment section what you think about it. So right now, I think that Tamale Teaching Hospital, their challenges or their issues has been solved. Items has been presented to them, and we hope that this time around they are going to work. We hope that the doctors will come back to their office and then attend to patients. So, ladies and gentlemen, first of all, I will, acknowledge the health minister for coming out to apologize to the doctors, because to complete a medical school, it's not easy. 7 good years. 7 years for you to come and talk to me like that. Okay, let me hold on. So, let me know how you see this in the comment section. So, that is the good news. Right now, we've seen some items. The items were not listed, but we saw some items that, according to the health minister, they are going to present it to the Tamale Teaching Hospital, and that is the good news right now. So, ladies and gentlemen, if you find the episode interesting, subscribe. I'm going to come your way very soon with another episode. I'm out.